capture easily within some few minutes, like 5 minutes, and then you are good to go. So quickly, if you are giving your care plan on that day of examination, you can see your candidate index number and signature. That's the first thing you should quickly do, and you start work. So write your index number and make sure you put in your signature. That is on the examinable care plan sheet. Okay. So quickly, you put our patient name down, the ward, you should know the ward that you are in, the bed number and everything. That will be given in the patient chart or the patient folder. And so quickly, you can be able to tell where you can have those information. So the patient diagnosis, the operation, the date of discharge, everything is on the patient chart. And so once they say start, just get the patient's chart and then you are good to go. And I was saying that the patient problems carries 2 marks, the strength carries 2 marks, and so you should know what to do. And we said yesterday that your problem number 1 should match your strength number 1. So problem number 2, strength number 2, number 3, strength number 3, number 4, strength number 4. If you go and mix it up, you will lose your marks. And so let us be guided by that principle. Now the routine care, we have care plan for surgical wards and medical wards. If I am on a medical ward, which you saw yesterday, there are certain things that are peculiar to the routine care, and a nurse should know this offhand, the candidate should know this offhand. For instance, when we come to the TPR, that is the temperature, pulse, and respiration, how is it monitored in the hospital protocol? And as a nurse, you know that it's monitored every 4 hours. So quickly, your temperature, pulse, and respiration, it is monitored every 4 hours. If per the doctor's order or per the patient's routine care, they say you should check temperature, pulse, respiration every 15 minutes or every 30 minutes, you should write it that way. Monitored every 15 minutes. That is what you should go into the TPR. Monitored every 15 minutes. That is what should go into the TPR. If the blood pressure says that monitor every 50 minutes or every 30 minutes, you can easily do that. So it is per the instruction of the physician that we write our routine care. So for the temperature, pulse, and respiration of blood pressure, it depends on the physician. If under no circumstance the patient is on a 4-hourly schedule, just go straight away. Monitored every 4 hours. Monitored every 4 hours. That is if the patient is not on any peculiar routine care. Monitored every 4 hours. Then you move to diet. Okay, we have the diet over here. Now under the diet, you should state the specific type of diet that the patient is on. Is it a normal diet? Is it a special diet? Is it a liquid diet? You should state the type of diet. And so under the diet, you can have just 2, normal or special diet, or maybe a fluid diet. You should just state it. If you go to the patient and the patient is able to eat any type of food, then that's a normal diet, simple. Then under the fluids, we are looking at the medical ward. If the patient can take in any type of fluids, you just go liberal fluids, liberal, you can take in any type of fluids. So that is what goes over there. But if the doctor has specified that the patient cannot take in A, B, C, D type of fluids, then the specific thing right there is what? Restricted fluids. Okay, restricted fluids. Right, this one should be off head. Intake and output. Is a patient on intake and output chart? You all know the intake and output chart that they put on the patient's bedside on the chart. So if the patient is not on intake and output chart, you just write not monitored on admission. Not monitored on admission. If the patient is on the intake and output chart, you just go straight forward. Monitored and balanced every 24 hours. That's all. If the patient is on intake and output charts, you write monitored and balanced every 24 hours. Oral hygiene. So with the oral hygiene and the bath, you tell us how the patient does it and with what. For instance, I brush my teeth twice daily using toothbrush and paste. And so at the oral hygiene, you can write twice daily using toothbrush with paste. Twice daily using toothbrush with paste. Okay, twice daily using toothbrush with paste. If somebody or the patient tells that, oh, I just do my oral hygiene once a day using chewing stick, you should write what the patient has told you. So once daily using a chewing stick. So you should state what the patient, how the patient does it, and with what. Simple. The bathing, once daily using maybe soap and water. State how it is done and then with what is being used to do it. Very simple. So I bath once a day with my soap and water, or I only wash my body with water. You should do that. If it's assisted bed bath, you should write assisted bed bath. You should specify it. Urine testing, is it monitored on admission? If it's not monitored on admission, just write not monitored on admission. If it's being monitored on admission, the body weight of the patient can easily be identified, and you just put the body weight over there. Activity. With the activity, now have passive or active or ambulant. So you can just go with passive exercises is correct, active exercises is correct, or ambulant. These are some of the terms you can use for the activity. And so with the routine care we are seeing, it is something that should be of head. Once I'm able to identify with this patient, it's not only special diet, it's not only special treatment, it is 4 hourly, it follows the same accord. One may ask, what if I am on a surgical department drawing a care plan? If you're on a surgical department, then you have to be careful with what you write under your routine care. So when I'm in a surgical department and there's a post-op case, a patient is back from theater, you know very well that with our nursing care, you monitor vital signs every 15 minutes. And so if at that instant you are with such a patient, you should know that your routine care will change. These are the things the examiners will look out for to determine whether the candidate understands what he or she is doing. So under temperature, pulse, and respiration, if it is being monitored every 15 minutes, you just write monitored every 15 minutes. The blood pressure, how is it monitored? Monitored every 15 minutes, every 30 minutes, you specify it. The diet, if they are back from surgery, they don't start eating. So you can write under the diet, nil per os. That's nothing by mouth. That if it's a surgical ward that you are drawing your care plan and the patient is not yet on food, that is what you should go about it. Fluids, you know, the surgical ward, still the patient is on IV fluids. So you can just write intravenous fluids. Intake analysis is monitored and follow the same pattern. So this is what goes on the front page. On the front page. And so yesterday we started with some various problems like patient has difficulty in breathing. We saw how to write a strength and we did a couple of things. Today we are going to delve more into the middle portion, which you can see on your screen, where that has the majority of the marks, which is 12 marks. We are going to look at how we can write nursing diagnosis. We will recap it again. Objective and outcome criteria, how to write it, nursing orders. Now, when you go into examination and it says start work, you are to draw the care plan, the front page, the middle page, only up to nursing orders. Please take note, this is very, very important. Some people, when they say start work, they draw the page, finish the whole middle portion, and even the back, and go and submit. No. You start the front page, and you draw the middle portion only up to nursing orders. Only up to nursing orders. And so we will be quickly bringing the second board. And so we are done with the front page now. We'll have the second board that depicts the middle portion of the care plan. We'll bring it out and we'll show how to fill that part also briefly. And so when they say start, you should draw from the front page and end at the nursing orders. It is after you are done with your various procedures that you come and intervene. So, the front page, the middle portion, and then you come to your medical orders. That is what you should do when you are given the part to start work. You leave the intervention and evaluation column. When you are done with your procedures, you come back to your care plan from the examiners and complete it. And so please let it have at the back of your mind that you are only to draw your care plan up to nursing orders and fill the back, leaving intervention and evaluation behind. That when you are done with your task, you come back to do. And so quickly, with that explained, yesterday we saw some medical terminologies that some medical problems we had, like patient has difficulty in breathing. We saw patient complaints of chest pain, and we are saying that where a candidate identifies a pain on a patient, you should state the location of the pain. You shouldn't just write patient has pain or patient complains of pain, full stop. No. You should tell the location of the pain. For instance, patient complains of abdominal pain. Because some examiners can mark you down when you do that. Where is the pain? They'll ask, where is the pain? And they'll penalize you for that. And so with a brief recap, I want someone to quickly type in the comment section, giving us a strength for patient complaints of difficulty in sleeping, as well as a nursing diagnosis. Anyone within the comment section can, I just want to see if you really followed us yesterday. Anyone from the comment section, if you get it correct, Licensure Hub has some few tips to give you afterwards. You note the username down and they will reach out to you. Patient complaints of difficulty in breathing, sleeping. What is the strength for that? And what can be a nursing diagnosis from the NANDA? Anyone type in the comment section. Anyone can share it on our WhatsApp platforms, wherever, and then we'll take it up from there. Patient has difficulty in sleep. As we are waiting for the answers. Please share the link that has been dropped, or you can just tap on share to your friends who you think they are ready for the examination, level 200, level 100, all over the country, so that we can all learn and understand the nursing care plan, because it's a part of our nursing care. It's a part of our nursing care. It's a part of our nursing care. We are dealing with patient has difficulty in sleeping, and so if you go and give a strength that patient has difficulty, patient can tolerate oxygen therapy, you should see that there is no connection between sleeping and oxygen. There is no connection. So we won't take that problem as a strength for that problem. Let's keep our comment flowing. Okay, so without wasting much time, so a problem like patient has difficulty in sleeping could be caused by several factors, maybe noisy environment, headache, and what have you. So a strength is what the patient even telling you that he or she is not able to sleep is a strength. Remember, we said a strength is what the patient has or can do to help solve the situation. And so if a patient tells you that, oh, I cannot sleep well at night, that is a strength. So your strength was patient could verbalize inability to sleep at night. The patient being able to tell you the next that, oh, I can't sleep is a strength. So patient cannot, or patient can verbalize he cannot sleep during the day or at night. That can be a strength. Okay. Another brilliant comment section that somebody has given a strength is that patient can sleep in a noise-free environment. Very excellent. You see, that is a strength. If the place is very serene, I'll be able to sleep. Excellent. So per the assessment, oh, why am I able to sleep? Oh, there's too much noise. So if I give you a noise-free environment, can you sleep? Oh yes. So that is a strength. Patient is willing to sleep or can sleep in a noise-free environment. Thumbs up for that person. Licensure Hub will surely reach out to you. Now, a nursing diagnosis for the sleeping problem. When you go into the nursing NANDA, there's a domain that we have called activity/rest. We talk about sleep and rest. So you see, we have insomnia, we have sleep deprivation, readiness for enhanced sleep, and we have disturbed sleep pattern. Now, you should be very, very circumspect when you are using any of them. When someone tells you, the nurse, that I cannot sleep well at night because of a noisy environment, you will realize that the appropriate nursing diagnosis you should use is what? Disturbed sleep pattern. Because I am not able to sleep because of a noisy environment. So there's a disturbance. So that is what? Disturbed sleep pattern. Okay, so that is what you have at the back of your mind. So sleeping problems are caused by various factors. Okay, good. Today we are going to do a very important side of the care plan. We saw the medical ward's few problems that you can have on the medical ward. Now let us look at some of the problems you can face when a candidate is on a surgical ward. Yesterday on the medical, we saw patients can be in pain, there can be feeding problems, there can be breathing problems, there can be sleeping problems, there can be knowledge problems. We saw how to write all those things. Those who couldn't join us yesterday, let me just briefly recap it for you. On the medical ward, we said you can have problems like pain, breathing problems, you can have knowledge deficit problems, you can have problems like activity of daily living. The patient cannot bath by himself, cannot feed because of weaknesses. Okay, that's some of the common things you can see on the medical ward. But again, do not go into examination with a cooked care plan. Some people try to cook care plan and they bring it to the exam hall. The examiners are trained to check whether you are lying or not. And so go there and fish out the problems that are present at that moment. Don't go inside with your own problems. No. And so, for instance, if I happen to be on a surgical ward, like the 37 Military Hospital surgical ward, like Eastmore ward, let's take Eastmore ward for example. On the surgical ward or in surgical nursing, you know we have pre-operative care and then the post-operative care. So we have the pre-operative problem. So before the patient goes to theater, you should know that some problems will definitely exist. Anxiety. I have been told that I'm being taken, I'll be undergoing surgery. So once a candidate is giving a patient who will be taken to theater within the next 24 hours or some few minutes, you can never escape a problem of anxiety. Because definitely, you've not been to theater before, you just fell ill, you came to the hospital, the next thing you were told that, oh, because of this your illness, we have to do surgical intervention on you. Definitely you'll be anxious. Hey, is it the end of my life? You'll be thinking too much. So that is anxiety for you. And so the best thing you can do at that moment is what? Take anxiety as a problem. So patient is anxious about what? How do you write that problem? So on the surgical ward, so I've identified anxiety. So somebody can quickly go, patient is anxious about impending surgery. About impending surgery. You don't just write patient is anxious. No. If you write patient is anxious, some examiners will mark you down. What is the patient anxious about? So anxiety. Patient is anxious about impending surgery. Or somebody can also go, patient is anxious due to the unknown outcome of surgery. Please, are we all getting the picture? So patient is anxious about unknown outcome of the surgery. I am going to surgery. I don't know that the outcome of it will it be positive or negative. It's anxiety. So patient is anxious about the unknown outcome of surgery. Can be a very nice point to write down. Or patient is anxious about the impending surgery or due to impending surgery. Yes, thank you, Belinda, for giving us that wonderful gift. Like Sasha Hub says, thank you very much. We encourage all those joining us to also show appreciation by also trying to give us more gifts, and we'll make it very lively. And so back to the surgical problem. So that is how to write an anxiety problem. You don't just go, patient is anxious. No. Even being on a medical ward, a patient can be anxious, but it depends on the time of admission. A patient cannot be on the ward for 1 week, 2 weeks, and you come and tell in an examination that patient is anxious on admission. No. If I